Bone health is a very important and perhaps under-recognized topic pertaining to general health screening. 50% of Americans, as we reach age 60 approximately, have reason to be concerned about their bone health. Bone health is important because later in life, having poor bone health or having osteoporosis, osteopenia can lead patients to have fractures that cause disability, that cause pain, and really affect their quality of life. And having osteoporosis or osteopenia means that the density of the bone has decreased over time. And that happens to everybody. So as we grow, as humans grow, we reach our peak bone density. So the densest that our bones will ever be is when we're about 25, 30 years old, depending on whether we're male or female. So from that point, for the rest of our lives, our bone density kind of steadily decreases, and that's normal. When it becomes abnormal is when the bone density and the strength of the bone reaches a critical point, which puts us at risk of fracture. And just because of our own physiology, women tend to reach that point faster than men. That's why osteopenia and osteoporosis is more common in women. It's not that it doesn't happen to men, it's just they start higher. So it takes more bone density loss to reach a critical value. I mentioned osteoporosis and osteopenia. So the way that we measure bone health is we use a special type of an X-ray that can tell us how dense the bone is, and then we compare the bone density of the patient with the bone density of the population on average, and we come up with something called a T-score. So having a T-score of 0 means that a patient has the same bone density as someone who has average bone density in the population at their peak. So after we measure bone density with that special X-ray that looks at the patient's bone density, based on how far from normal that bone density is, we describe it in a couple of ways. Osteopenia is when you have decreased bone density, but it hasn't reached the same critical value as a patient with osteoporosis. So osteopenia means decreased bone density, but not critically low. When you have osteoporosis, it means that you have decreased bone density further than osteopenia, and the risk of fracture is higher. The most common areas where patients have decreased bone density that becomes problematic is most commonly in the spine. Patients can have fractures that are usually called a compression fracture in the spine when the vertebrae gets squished. When the vertebrae doesn't have enough bone density, enough strength to maintain itself under normal circumstances. Another common place for low bone density to become an issue is in the hip. And a hip fracture is a huge problem. There's a lot of morbidity and mortality associated with that condition. And when the bone density in the hip reaches a critical value, osteoporosis puts the patient at risk of a hip fracture. And another place that bone density can become an issue is in the shoulder. A lot of patients with osteoporosis can sustain a low energy fracture of their proximal humerus or the shoulder. And many of those patients can also sustain a fracture of their distal radius, their wrist.